Hi everybody, it's two pea brains with potty mouths talking shit about MS again. Kathy Reagan-Young, Erin Glace. We just in our last video talked about what a UTI is, and as I said, we're going to break this up a little bit. So if you're just interested in what a UTI is, you can go back to the last one and find that out. But now I want to know about the symptoms, and I've heard from a lot of people about a lot of different symptoms, but let's hear from the expert. What kind of symptoms goes with a UTI?
Okay, very good question. Again, just to emphasize that a urinary tract infection or a bladder infection is an infection, so it does need to be treated. Sometimes it's hard to tell. Did I eat something that's kind of bothering my bladder, and I'm just burning a little bit more? So to identify a urinary tract infection, you want to think about frequency. Okay, are you having an increased frequency of urination? Are you having a burning with urination? Are you having an urgency? So the difference between frequency and urgency is that frequency is obviously increased number of times. So if you're all of a sudden, I have to go 9 or 10 times in the day when normally I was going 3 to 5 times a day. Urgency is, boy, I better get there quickly, or I feel like I'm going to lose it. That's urgency, and you will get a strong urgent sensation oftentimes with a UTI.
Or too much beer. That's another story.
That's very true as well. So pain with urination is often a symptom of a UTI or a bladder infection. So you sit down to urinate and it burns. And that's often very targeted to the urethra. Not always, but it's very targeted
I like the way she's doing
to the urethra. Yep.
Okay.
Right.
Thank you, Vanna.
Exactly.
That would be right here.
Now, the infection part of it will lead to sometimes a feeling of nausea, a feeling of just being very tired and fatigued.
Hey, there's something new for us.
Yeah, right. I know, unfortunately.
So it can make it worse. I mean,
Exactly. If you have fatigue and fog with your MS, if that's one of the symptoms, then, that upticks along with the other symptoms. I've had patients say they get headaches. They get really fog. Again, it's an infection,
right? So
it does need to be treated. Got to emphasize that. But all those symptoms, if you have frequent urinary tract infections, I've had patients in the past who would have one specific symptom that they identified as being a urinary tract infection, including low back pain. Okay, so don't discount low back pain that's kind of sudden onset with a little bit of increased frequency with some pain with urination. Those are all things you should listen and feel for.
Okay, so how do you identify if you do have a UTI? I mean, you've got these symptoms. How do you know for a fact that it is, in fact, a UTI?
Very good question. The best way is to go in and see your doctor. Okay. You're going to go into the doctor and they're going to take a urine specimen.
Okay. Pee in a cup.
Pee in a cup, exactly. And with that urine specimen, they can often identify certain markers within the urine that will say, okay, we can see today that you've got an elevated level of nitrates, things like that, that will have them treat you that day.
Okay. Well, I'm sorry, go ahead. I'm getting excited.
Okay.
Because now my question was, okay, you pee in the... I pee in the cup and they dip the stick in there, right? And that's how you're saying they can identify.
Well, that's one way.
Oh, okay.
Okay. Then there is also they'll culture your urine, so they'll actually send the urine away to a bigger lab or an outside lab. Sometimes they do it on site, depending on the practice. But they need to see what kind of bacteria grow. So that's what it's called when it's a culture over time, because then you can clearly identify what bacteria is causing the infection. Again, with patients who have frequent urinary tract infections, you're going to want to make sure that your urine is cultured so that they can treat with the appropriate antibiotics. So that's identification. You pee in a cup, they dip the stick. They will often culture it, especially if you have frequent urinary tract infections.
Okay. What about these sticks I see at well, I almost said the name of the drugstore that I go to,
Right.
but we might get in trouble for that. So
I
I'm going to
don't
not say that, but you know, drugstore. Yeah.
Corner drugstore.
Yeah.
Right. There are some home tests that you can use, and that will help you to say, you know, this is something I need to go see the doctor about, okay? Because it will give you a reading of some markers in the urine. Then you would definitely see the doctor about.
Well, and I would think in the case of an MSer who has some of these UTIs recurring,
Right.
maybe you could get to a point with your doctor of being able to do this at home and call and say, this is, you know, I tested, this is what I'm seeing, and maybe they would be able to save you a trip from going in.
You know, that's a possibility. That needs to be a relationship that you have
Yeah.
with your doctor definitively, because again, we want to make sure that they're treating appropriately with the appropriate antibiotics.
Because different bacteria requires different antibiotics,
exactly,
right?
Exactly.
Look how I'm learning. I'm going to be the expert soon.
Wonderful.
Well, that's it for our symptoms. Got it. So now we know what a UTI is. We know what kind of symptoms to look for and how they test for it. And we'll answer some other questions. Thanks so much for sending them in. That's where these things are coming from. You guys are sending in questions, and we really appreciate it. And so we're going to endeavor to answer more and more questions. If you have one, please put it below in the comments or email me at Kathy@fumsnow.com. And while you're over there at fumsnow.com, feel free to sign up for our free newsletter, and you'll be the first to know when our ebook comes out, or any other tips and tricks for living your best life with MS. So thank you, Erin.
You're welcome.